interns.
Some of the colleagues have highlighted that it becomes quite challenging for them to extend these services to their facilities. I just wanted to know, what is it that you did different from them? Because I think Katutora also had a similar challenge. So what are the lessons probably that you can tell to the colleagues in regards to that?
All right. In regards to clinical pharmacy, it has to start with the pharmacist in place. So people who are really pharmacists who are interested in clinical pharmacy is the one that you would draw into your institution. So you would motivate for pharmacists who studied clinical pharmacy or who are interested in clinical pharmacy that would like to go to school in the next future for clinical masters in clinical pharmacy. And these pharmacists are the ones that come up with a roster on how to go towards. So currently, as we speak, we have 6 pharmacists who are just placed in internal medicine wards, which is the places where we see most of our patients. They're overcrowded in that particular firm. These pharmacists really have to be interested in learning the new advanced medicine and treatment for the various conditions, non-communicable or communicable diseases, and they should be able to wear their shoes and be confident enough to give advice to the specialists and wear their shoes in terms of the clinical team that they have to be in. They have to be vocal for them to be seen and be acknowledged that they are bringing change to this particular patient. And we really have to go back.
The Directorate had recently launched the National Medicines Policy in 2022. Strategy 2.9 deals with human capacity development. So we'd just like to know how far the Directorate has come with implementing the strategies that support the advancement of the pharmaceutical services in addressing global health challenges.
Okay, thank you so much to Akula for that question. That is indeed true. We have recently launched the National Medicines Policy. It's a document that we are very proud of, and it's so wonderful because all of our interventions now stem from that same document, and we are able to really get collaborations from all our stakeholders because everybody can see exactly where we are going, exactly where we plan to be in the next 5 years, because this policy document comes with an implementation plan. So according to that implementation plan, under the human capacity development, we have 6 different strategies. The first strategy has to do with the essential medicines concept and incorporating that concept into the training curricula of all the pre-service training curricula for all healthcare service providers. This is to make sure that everybody within the healthcare supply chain understands how their role and how it impacts the supply chain. For example, medical officers, they do their prescribing, but if they understand the essential medicines concept well enough, then we'll be able to have a much smoother supply chain, because every participant within the supply chain understands what their role is and how it impacts the rest of the supply chain. So what the Directorate does is, when the curricula for these relevant health professionals of medicine are incorporated in these curriculums, because it's important that when you get these healthcare workers in the public service, they've already got a ready understanding of these concepts. It makes the work for the pharmacist on the ground much easier, and it's much easier for you to then streamline these professionals into the existing protocols. The other of the 6 strategies that we have is that government designs a career development structure for the pharmaceutical service providers in line with other health professionals, and this is to facilitate professional development while motivating staff. And to this end, what the Directorate has ensured is that we place pharmacy staff at each and every district hospital. I know in this day and age you would wonder that if UNEM has given us 250 pharmacists over the past, I think 13 years or so, how is it that we don't have enough pharmacy staff, and how is it that we are only now boasting about having a pharmacist in each district hospital? But one of the issues there is really attrition, and that was really a big issue for us. But now that we see the numbers coming in, because attrition was not only due to staff actually leaving, maybe Namibia, going to the UK and so forth. It's actually a battle between pharmacists in the private sector and pharmacists in the public sector. So now that the market is somehow saturated, not for Bonnie to stop training, but a saturation that we are happy with. It means that there are pharmacists available for the public sector so that we can balance out the ratio. I think the ratio was something like 10% of the pharmacists are in the public sector and 90 are in the private sector. So even though we were having those high numbers, it was really a gaping, a glaring difference between the recruitment in private versus public, but we've been able to at least balance that out, and that's why each district hospital now has pharmacy staff. We also have a restructuring exercise that we are participating in. I myself am a part of that task force, the restructuring task force. It has been going on for the past, I think, 15 years. Of course, I wasn't there in the beginning. But it has been going on for quite some time, where the ministry aimed for us, so that there can also be a cadre recognized on this ministerial staff establishment. And this will ensure that all the cadres are recognized and able to perform their functions efficiently, and it also allows for career advancement, in that you can start from a pharmacist assistant and then you have a step in between where you can then progress to become a pharmacist. So I think that was a crucial step that we are supporting. The third strategy has to do with in-service training and continuous professional development. So despite the fact that pre-service you are well-rounded, in-service training is also just to keep giving you the reminders and of course the updates.
I think we have noted and seen that there are a lot of mushrooming institutes related to health, particularly pharmacy as well. We'd just like to know how the Pharmacy Council is maintaining the high standards in pharmacy education to prepare pharmacists for evolving global health needs and the new areas of healthcare. What exactly is the council doing about that to maintain these high standards?
Okay, thank you for the question. The Pharmacy Council of Namibia is plays a pivotal role in that sector as a sort of like a regulator. The key element is that pharmacy education remains rigorous, relevant, and make sure that I know our president mentioned that we kind of have enough institutions as it stands, but what we really aim to do is to ensure that everybody that is practicing with the right acumen, at the right standards. And I mean, if you can just try and relate that personally, we're not only trying to create red tapes to the industry, we are trying to ensure that our people receive the best there is. But not only that, we go the extra mile of also looking out for the students. We've had situations where, you know, the mothers are crying in the communities where my child went to do this course for 6 years, they come back and all of a sudden they can't practice. Or no, I went to the hospital and my other professional is telling me that what I received from this institution is substandard. So as a council, what we do, we then try to employ key stakeholders. We have I think it's the NCHE, and then we have the Namibia, the MQA. What we then do is those requirements are there. We simply just put it out to anyone that is coming in the industry to say, have you done this? And then this is a call, and
we are doing concepts of harmonizing the work that we do, because we are operating in limited resources settings. Therefore, we rely heavily on what others have done.